Okay, welcome to open enrollment. You all get the lucky pleasure of being involved in the meeting that we are recording. So keep that in mind, we are recording this meeting. So if we could keep the side conversations down during this meeting, that would be helpful so we can make sure anybody watching this can hear. So just a little bit, quick introduction. I am Kelly. I am our Human Resources Administrative Assistant. Typically you would see Jody, our Payroll and Benefits Coordinator, at these meetings. However, she is on leave, so she's in and out of the office. We still both are communicating with each other and available, so if you have questions, either one of us can really help you. It's helpful if you actually send your emails to both of us right now. That way, whenever Jody's out of the office, or if I'm out of the office, we know what's going on and can keep each other in the loop. So just a quick agenda of what we're going to go through today. First, we're going to talk about open enrollment, what is it, when is it, that sort of thing. Then we are going to talk about a qualifying event, just to kind of recap that, to remind everybody. We also are going to go through our medical plans with WPS and Aspirus Arise. And we're going to talk specifically about the plan changes. We do have some plan changes this year. Also, we're going to talk about jumping back. We're going to talk about the standard and extended, the Aspirus Arise versus the WPS statewide. That's something a lot of people have questions about. So we're going to tell you, Diane from WPS Aspirus Arise is here with us today. She's going to talk to you specifically about the differences and how you can best decide what plan works for you. We are going to briefly talk about Teladoc and our home delivery prescription plan, Express Scripts. Those are two cost and time savers for you, so those are something we want you to know about and we want you to use. We're going to briefly go over our vision and dental plans. There are no changes, but there are some common questions that we want to address with you. And then we also are going to present our new voluntary short-term disability plan to you. It's something we're extremely excited about. It's something a lot of our employees have been asking about. Kelly from Horton is going to be joining us in a little bit. When she gets here, she's going to bring along your personalized short-term disability forms, because short-term disability is based on your income. So we actually put your income so you can see exactly what your benefit will be and exactly what you will pay bi-weekly, so you can make that decision. And then we are asking that everybody return those, regardless of if you're enrolling or not. There is a little checkbox if you're declining. And then if you enroll, obviously you fill out a little bit more information. And then we also are going to briefly go over our flexible spending plan. So just to recap what open enrollment is, this is the one time of year that you are able to make changes to your health insurance and other insurance enrollments, including switching from extended to standard or standard to extended. This is the one time of year you can do that. Qualifying events do not allow you to switch health plans, only open enrollment does. So keep in mind, our open enrollment is open right now and it closes November 3rd. So we need your forms back, your short-term disability form and your benefit election forms by the end of the day on November 3rd. So whatever you are electing right now is going to be effective January 1st, 2018, and it's going to go through until December 31st, 2018. So make a wise decision on what you're choosing, because you are going to be in it for an entire year and we are unable to make changes, especially to the medical plan that you choose. So also keep in mind, with a January 1 effective date, that means for your pre-tax benefits, your health insurance, your vision, and your dental, those are going to actually start in December. So the pay periods in December are going to be those new premium rates. Briefly to go over what a qualifying event is. So a qualifying event allows you to add or remove dependents or plans outside of the open enrollment time throughout the year. What we mean by qualifying event is maybe a marriage, a divorce, birth, or a death in your family, or even a change in a job status, your spouse, or you personally. So you have to keep in mind that you need to do this within 30 days. It is extremely important. If you wait past 30 days, we really can't do anything anymore. So make sure that from the date of that qualifying event, that life change, you fill out the qualifying event form and you get it back to Human Resources so that we can make the changes that need to be made to your plan. And just remember, like I said before, a qualifying event does not warrant a new choice of plan. You can't move from extended to standard or standard to extended. You can only add or remove, okay? briefly we'll talk about the proof of eligibility needed. Most of you this isn't going to apply to, but if you have a qualifying event or anything like that, you'll need to know this. If you are going to be adding a spouse to your plan, we do ask for proof of eligibility to show that they are able to be covered under our insurance plan. This could be a marriage certificate or that front page of your federal tax forms. Black out your financial information. We don't care about that. We just want to see that they are listed as your spouse. The same goes with children. If you're adding any children on your plan, we want a birth certificate or we need that front page blacked out financial information showing that they're a dependent. And there are special rules for children of divorced spouses, so please, if you have any questions related to that, we will help you. All right, now I'm going to turn it over to Diane, and she'll go forward with our benefit changes.
Good morning, my name is Diane Stroig, and I'm with Aspirus Arise and WPS. So I'm here to talk to you today a little bit about some of the changes that are occurring with your health plan, hopefully give you a little bit better understanding of your benefits and answer any questions. There are a few changes to the plan this year. A small change in the primary care provider office visit copay as well as the specialist copay. You'll also see a change in the emergency room copay, a little bit difference in the maximum out-of-pocket amounts. As Kelly mentioned, Kelly from the Horton Group will be here with us a bit later, and she will be talking to you about a new voluntary short-term disability plan that Wood County employees can take advantage of. And then also we'll talk about some changes to the contributions that come out of your paycheck for the plans based on your wellness participation. So you have two plans that are available to you. One is referred to as the standard plan. That uses the Aspirus Arise network. And the other plan is called the extended plan, and that uses the statewide WPS network. Just so you know, the benefits under both plans are exactly the same. The only difference is the network. So the Aspirus Arise network is going to be the local Aspirus network in addition to any Aspirus provider throughout Wisconsin or in the Upper Peninsula of Michigan, as well as a number of independent providers in our local area. It also taps into a number of larger health systems in the state of Wisconsin, such as the UW, Gunderson, which is over in the La Crosse area, Aurora, which is down in the Milwaukee area, Theta Care over in the Fox Valley, and other providers. It does not include Marshfield Clinical Ministry, so that's something really important to know when you're choosing your network. The Aspirus Arise plan is going to be more affordable for you than the statewide, and that's because Wood County is able to get much greater discounts through that plan than they are through the statewide plan. If you do doctor at Marshfield or Ministry and you wish to continue to do so, you would need to choose the WPS plan if you're not, interested in transitioning care over to the Aspirus Arise network of providers. What I brought with me today, and they're on the table there, and I encourage you to grab them, is this flyer is going to help you search for a provider in the Aspirus Arise network. And this one will help you look in the WPS statewide or for the extended plan. So I really encourage you before you make your plan selection to think about where you get your care, not just maybe where you go to the walk-in, but do you have a chiropractor? Do you seek physical therapy? Does your child have a pediatrician? All of those types of things to make sure you're making a good choice for you and your family. Because as we walk through the benefits, you'll see you don't want to pick a plan where you're then in an out-of-network situation with your provider. So the benefits are much better when you're in network, so you want to really pick a plan that's going to be best for you and your family. So both plans have in and out of network benefits. So on the in-network side, the individual deductible, so the deductible per person is $500. If you're on a single plan, you will have to meet that deductible for a number of services before the plan would pay. If you're on a family plan and you only have two people, maybe you and your child or you and your spouse, then you will have two deductibles. Each person would have to meet $500. But no one person on any plan will ever have more than $500 in deductible to satisfy. Then if you're on a family plan and you have 3 or more people, you would have to meet 3 deductibles. So Again, no one person can meet more than $500. As a family, you would need to satisfy $1,500. After you've met the deductible, the plan pays at 90% in-network, 70% out-of-network. You'll also see that the out-of-network deductibles are double what the in-network deductible is. That's why it's very important that when you choose your plan, you're going to an in-network provider, because otherwise you're going to have double deductibles, and instead of paying 10% in coinsurance, you're going to be responsible for 30%. Also, if you're seeing an out-of-network provider, you can always get charged or balance billed for usual and customary. Because that out-of-network provider isn't under contract with your insurance plan, they don't have an agreed upon fee amount. So your insurance is going to pay usual and customary for out-of-network provider, and then you could get balance billed for amounts over that. So again, really important that you're seeking care from an in-network provider. So now we have the out-of-pocket maximum, and what that is that's the total any person or family unit is responsible for. That includes the deductible and the coinsurance. So when I say coinsurance, if you're in network, that's your 10% that you're responsible for. If you're out of network, that's the 30% you're responsible for. So the maximum for a single person is $1,150. $500 of that is the deductible. The other $650 is your coinsurance amount, that 10%. If your 10% ever equals $650 or more, then the plan will begin to pay at 100% for those services that are subject to deductible and coinsurance. For a family of two, that limit is $2,300. That's the $1,000 deductible for two people and $1,300 in coinsurance. And then on to the family plan is $3,450. That comes from the $1,500 in deductible, and then another $1,950 in the coinsurance. Again, on the out-of-network, you'll see those amounts are almost double. You're looking at $2,250, $4,500, $6,750. There is no lifetime maximums amount anymore in your health plan. The Affordable Care Act really took that away, so it's unlimited. Now we talk about the federal out-of-pocket maximum. That's something that the government says every health plan has to tell their members what is the maximum amount you would ever be responsible for in the worst case scenario. So you'll see the amounts in network are $7,350, and then the family is $14,700. It's not applicable on the out-of-network because really your costs can be somewhat unlimited because you've got that balance billing in there. So if you look down here, that seems really high, that $7,350, because I said before here that the maximum you're going to have for deductible and coinsurance is just that $1,150. So the only thing that you would continue to pay for once you've met that out-of-pocket maximum of deductible and coinsurance is the co-pays on your plan. So there's some services that have a copay. You don't have to meet your deductible in order to have those services paid for. Those services are things like office visits. You have a $25 office visit copay in 2018 for a primary care physician. You'll have $50 for a specialist. Emergency room will have a $250 copay. This year it's $150. Therapies. If you go to physical therapy, speech therapy, or occupational therapy, those have a $25 copay per visit. And then chiropractic care. Chiropractic care has a $25 visit per copay. And then you've got your prescription copays. Those are the only items that would accrue up to that $6,200 for an individual, or over here $12,400 for a family of two, $11,250 for a family of three. So you can see you would have to have an awful lot of services to ever reach that limit. Most people, I don't even know hardly a scenario where you would ever meet that limit, but nevertheless, the government requires that we tell you what that maximum would be that you would be responsible for under the plan if you ever did have that volume of copays on those types of services. Does anybody have any questions on this slide? It's a lot of information. Yes?
For out of network emergency room,
Yeah, we'll talk about that on the
Okay.
next slide.
sorry.
So, we'll just wait when we get to there because emergency room is a little bit different. So again, remember I said your benefits are the same regardless of what plan you're on. The only thing that's different is the network. So we talk here again about in and out of network and how are different services paid for. So we start with our physician office services. Primary care physician office visit is going to be a $25 copay. So if you go into your primary care provider, you have an office visit, let's say they may even draw some labs or do an x-ray, you're just going to pay that $25. Anything that's done in the office that day is going to be paid for except for your $25 copay. So if you have a strep test, a chest x-ray, those types of things. You can see now if you're out of network, you're gonna have to meet the deductible, which if you remember on the prior slide was $1,000, and you're gonna be responsible for 30%. So you may end up paying, you could pay $200, $300, $400 for that office visit if they did lab and x-ray office visit versus $25 if you're in network. So kind of the importance of staying in network. Same as if you go to a specialist. You're gonna be responsible for a $50 copay. Again, if they do other services in the office that same day as the office visit, you're only gonna just pay the $50, whereas out of network, you're gonna have to meet your out of network deductible, and you're gonna be responsible for 30% after you've satisfied your deductible. Therapies, that copay is $25 a visit. So if you're having physical therapy, speech therapy, occupational therapy, every time you go in, you will have a $25 copay. These services that I'm talking about are not subject to the deductible when they're in network. So your copay accrues to that separate copay bucket we talked about on the prior slide, but you're not having to meet your deductible first, which is kind of nice. Then we talk about Teladoc. Has anybody in the room used the Teladoc service? Does anybody know what the Teladoc service is? So if you're on the plan today, you have a little logo on your ID card for Teladoc with a phone number. And what Teladoc is, it's the opportunity to have a telephonic office visit. So over the phone office visit with a physician. This is something that's really convenient for some of those more primary care conditions such as a sinus infection, maybe an ear infection, pink eye, some of those more common ailments. So rather than having to go sit at the walk-in and take your time and you're not feeling well and you have to go by other sick people, you can call and it's a $10 copay. So if through the course of that office visit over the phone, if they feel that a prescription is appropriate treatment for you, they can call that into the pharmacy for you. So I really encourage you to use this service if you haven't. Kelly's going to talk about it a little bit too. You can sign up ahead of time or register so that they have all of your personal information so that when you may need to use that or have your family member use it in the future, they've already got all of your information. It's also a really handy tool if you have kids away from school. I have a son at school in Madison, and he called me and said, I think I have strep throat, I don't feel good. And so I had him call Teladoc, and it worked out really well for him rather than he doesn't have any good mode of transportation trying to find a way to get to a walk-in clinic. So really encourage you to use that, and it's quite a cost savings over even just an office visit copay. Chiropractic care, your plan offers 20 visits per year. It does not cover maintenance care. And for every visit, you would have a $25 copay. For preventive care, so these are all the things that the Affordable Care Act says that a plan has to provide coverage for. So your routine physical, your cholesterol screening, for women, a mammogram once you turn 40, your yearly pap and pelvic, a colonoscopy for people 50 and older, all of those types of things. But you need to know that Wood County really wants you to go in and have those services done. It's really important in maintaining good health and catching things early on if you go in every year. but you need to go in network in order to have coverage for preventive care. You can see on the slide that there is no coverage for this out of network, okay? Urgent care center. Under your plan, you'll have a $75 copay for urgent care. One thing I know in our area is most of our local providers, including I live in Wausau, in the Wausau area, they don't really bill urgent care. You're kind of either at the walk-in or you're at the emergency room. But if you were to have services and they were billed as a true urgent care center, you would have a $75 copay that would apply. Hospital services, so if you had to have an inpatient stay or outpatient services at the hospital, those will be subject to your deductible, and then they're subject to coinsurance. So if you're in network, after your deductible, they'll be paid at 90%, you'll be responsible for 10%, and out of network, they'll be subject to your larger out of network deductible, and then the plan would pay 70% and you would pay 30%. Now emergency room, you had asked about emergency room. Emergency room is paid at the in-network benefit level regardless of where your care is rendered, okay? However, I want to tell you that if you do go to an out-of-network emergency room, you could again be responsible for that balance billing I mentioned earlier, because the hospital is not under contract with the health plan, and the health plan is going to pay at what is usual and customary. So if you can ever, use in-network, certainly you want to do that. If you know you're going to be traveling out of the area, or you have a child that lives out of the area, use the provider directory and just kind of familiarize yourself with what's in network and what's out of network. We have a very robust, on both plans, a very robust network statewide and nationally. So you also have access to, we call it a wrap network. So a network that wraps around your primary network that's available also on a national basis. And there's information on your ID cards about that, and you can also search in both provider directories. It's called the First Health Network, and you can check via state by state. So if you know you're going to be going somewhere on vacation for a week or two, or you're going to visit a relative, that's something you can always do ahead of time, and hopefully you never have to use it, but it's there. So you would have a $250 copay, and then after that it'd be paid at 100%. My advice to you is use emergency care only when it's really truly an emergency. Emergency care is very expensive. You have other options on your plan, such as walk-in. If you're not quite sure if you need to go to the emergency room, you could use the Teladoc. Again, you're going to get charged the $10 regardless if they say, I think you really need to go to the emergency room. They still did provide a service to you, but maybe they will give you some other options that you could try until you can either get into the walk-in or into your primary care physician. Does that answer your question then on the emergency room? Okay. And then lastly, we wanted to just talk about prescription drugs. So under your plan, you have a separate prescription drug deductible. It's a $100 per person or 200 family. It only applies to Tier 2 and Tier 3 drugs. So if you take generic drugs, which are also known as Tier 1, you would not have to meet that deductible. But if you take Tier 2, which is known as preferred brand, or Tier 3, which is non-preferred brand, that deductible would apply. So your co-pays at the retail pharmacy are $10 for generic, $30 for a brand name, and $50 for a non-preferred brand name. Now if you use mail order, you can, and typically you're going to want to use mail order for a maintenance medication. And what I mean by a maintenance medication is something that you take every day, blood pressure medication, cholesterol medication, things of that nature. If you get it filled through the mail order, you can get a 90-day supply for 2 copays instead of 3. If you go to Shopko or Walgreens or CVS, you're going to have that first line of copays for every 30-day supply you get. If you go through mail order, you're only going to have 2 copays, so you're saving 1 copay for you or your family. If you've never used Express Scripts or mail order, it's very, very easy. Again, on your ID card, there's a little Express Scripts logo with a phone number. Human Resources also has forms on the internet that you can access. Basically, instead of your doctor calling a prescription in to say Walgreens, they call it into Express Scripts. You can set up an account with Express Scripts. I've done this for me and my family, so it's very nice when you have a prescription that's ready to be refilled. They'll send you an email or a text. I think you can get text messages as well, and it'll say your prescription's ready to be refilled. All you do is click yes, and they charge it to whatever card you have on file. So if you put money in your flexible spending account and you have a benefit card, you can link that benefit card to your Express Scripts account. It'll automatically come right out of there. When you get your prescription in the mail, it'll have a receipt, so you can keep that receipt with your flexible spending account information for the year. It's very convenient. Has anybody used Express Scripts mail order? Okay. Do you have good experience with it? Yeah.
I was gonna say, is there anybody that has not or is worried about that? Because being on the wellness board, that's one of the things we heard that not a lot of people are familiar about. But you take any smartphone, there's an app on here, you just click on it. I already have my information in there, it doesn't take very long to set up. You just click on refills and renewals and then select the med that you want refilled. If the doctor needs to see you or something like that, because they have to do it on a yearly basis, they'll ask to see you. But otherwise, like Diane said, they'll just send it and you'll get it in the mail in a couple days. So it's super easy. It's a good way to save money, but also save money for the plan overall. We spend about $1 million a year on our $9 million health plan on prescription drugs. So if we can save some money by doing this, it's super easy. And if you need help with that, certainly reach out to your wellness champ or Adam, and they can help you get that set up.
The only thing I have, if your medication is sensitive to heat or cold, I have been advised by my doctor not to use Express Scripts because both of mine are that, because the post office does not guarantee that they're not going to be out too long in the cold. The trucks where the stuff is stored is not air conditioned or heated, so it's just something to be aware of with your medication.
Yeah, it really depends on the medication. I think my wife's birth control, it was something that you couldn't get a 90-day supply at Walgreens, but if you did it through Express Scripts, you can. So again, I would just recommend that you look into it. It's not going to be for everybody, but you can save some money doing that.
Will that cover, well, I don't know if it would be considered a psych med, but my son takes Adderall. Will that cover that? I mean, can you get that through that Express?
He should, I can't tell you on a specific drug.
If it's a Schedule I,
It's,
Yeah,
I
okay.
think you have 3 months
I
more.
have Ativan, and you cannot get that through, you have to go through the clinic.
And if you have a question about a specific drug, I would just give Express Scripts a call, give them your insurance card information. The other thing is if you are looking to do this, you may, when you call your doctor's office or again talk to Express Scripts, just ask them to write it so you can get it filled in a 90-day supply. If they just say 30 days, then Express Scripts may have to go back to the doctor and say we need a 90-day. But I know I've over the years, anytime I've had to have anybody in my family take something ongoing, I always try to get it filled in a 90-day, written for a 90-day supply so you can use mail order.
And they'll also give you suggestions on the apps if there's other medications that might work at a cheaper cost. They'll give you those suggestions too, so you can just talk to your physician about that as well.
Any other questions on
Quick
this?
comment about the temperature. I have a family member that we use Express Scripts for insulin. It's overnighted, which, this time of year, whether you pack it with ice or not, but during the warm months, it does come packed in ice in the nice styrofoam cooler. We've not been able to tell a difference, that the insulin effectiveness has been damaged,
Right.
so.
Mine's pill form, it can be. Otherwise, thank you though for the insulin information. That helps.
Anybody else have any questions on
Future.
the information on this slide or anything that I talked about? Okay. All right, so I wanted to talk a little bit about what's the difference between a primary care and a specialty care provider, because as we talked earlier, there is a difference in copays on when you go in. So a primary care provider is, a physician who directly provides or coordinates a range of healthcare services for their patients. So I really encourage people, start with your primary care doctor. Some specialists have gotten to the point where they may be very busy and they'll say, you really need to go through your primary care and get a referral from me to come to me, because they want to make sure they're just seeing the patients that they really should see, and it's not something that you can deal with your primary care provider. So primary care is going to be anybody in the area of family practice, internal medicine, general practice, OBGYN for women, pediatrics for children, and in addition, a physician assistant, a nurse practitioner, or a certified nurse midwife. When we talk about specialty physicians, it's really going to be anybody outside of those areas of primary care.
All right, I am going to take back over to briefly discuss the discounted premiums with the wellness program. But before I jump into that, I just want to reiterate one more time how important it is to take these flyers telling you how to find a doctor. They are on the Human Resources intranet page. You can access them there as well. You can always call us. We can help you use the website. But if you choose the wrong plan, unfortunately, you're stuck in it, and you are going to end up with those higher costs that Diane talked about with out-of-network. So please, just make sure that you take the time to make that decision. Talk to a spouse, a parent, whoever you need to talk to help you make that decision. Make sure, like Diane said, check your chiropractors, check your therapist, check your child's therapists. Make sure that those things are in-network, or you're comfortable with switching to one of the in-network providers that are available to you. Okay, so talking about the discounted premium rates for wellness, hopefully this isn't a surprise to anybody in this room. Fortunately, Adam, our wellness coordinator, has been out and talking to all of our employees about this a lot and has had multiple informational meetings. So keep in mind that for your discounted premium rates, you need to complete the 3 core activities. First, your biometric screening. Second, your health risk assessment. And third, your health coaching. These are all simple tasks that don't take very much time, and they're meant to help you lead a more healthy life. So please, if you haven't done these already, this is due by October 31st. So you only have about 1 week. So if you're sitting in this room, you don't know what I'm talking about, you're on our health plan, you need to contact Adam right away. And you need to figure out how you can get these things scheduled for next week.
Is that on our dashboard for ManageWell?
Yes.
Is it?
Well,
Like if you've
what-
completed those 3 things?
Yes.
If you're in the wellness
Yes.
already, if you've been participating in wellness, you are set for this year. This would be for somebody who hasn't participated yet. Going forward, we're gonna do this in Q1, correct?
Correct. New employees, so if you were hired in 2017, you are given the premium incentive for 2018. However, to keep your premium incentive for 2019, you will need to complete those things in the first quarter of 2018. It's very important, like Kelly said, by October 31st. Otherwise, if you've seen the rates on the sheets, you're gonna be paying at least double what you're currently paying. So it's very important that you are participating in that if you wanna keep your premiums down. It does say that on your ManageWell, if you've completed all those 3 things. 2, you can check with Adam, just to clarify and make sure. But there's still a number of people that have one of those things outstanding. If you're just waiting on the health coaching, don't wait for Adam. He's trying to get probably over 100 people through. It's your responsibility to contact him and get those completed.
Yes, so as you can see, like Jordan mentioned, there is a stark difference in the premiums. Up top is without wellness, down here we have with wellness. So if you look at just the single full-time premium without wellness, it's $76.25. And then we go down to single full-time with wellness, it's $38.13. So it's a huge difference. It's going to be a huge impact to you if you aren't participating in wellness. The same thing is true with our extended plan, the exact same thing. So please participate in wellness. If you aren't already participating, I think it's great to not just do the biometric screening, to do everything about wellness. It's fun, healthy competition, yes.
My question is, like, I'm enrolling for the rest of 2017. is there a way for me, I've already talked to Adam and he's helping me get stuff done, but, is there a way for me to get the discount for the rest of the year yet?
The rest of this year?
Yes.
We're not on
You're,
this.
you're already on that discount because
Okay.
currently the current plan is set up at a 90/10.
Okay,
And this won't take effect until the first of this year. However, the premiums will start coming out on your first pay period in December, because we take out a month ahead of time. So again, the other thing is, if we have new employees that start in 2018, they're gonna be grandfathered in for 2019. But then in 2019, to get the 2020 premium incentive, they have to get it done in the first quarter. Two, if you do those first three things, you're automatically gonna get $100, because as part of the wellness program for the first quarter, you'll have all the required activities to earn your $100.
okay, he's working at getting me through the first three, but, will that then, before they actually, by the due date, he extended it because of some, because of when I go full-time.
Yep.
But, the premiums will be taken out, you're saying grandfathered for
Yep,
this
so
end of
you were
this year?
hired in 2017,
Mhm.
so you automatically, regardless if you did this year or not,
Mhm.
you would be getting the premium incentive for all of 2018. To keep your premium incentive for 2019, you will have to do all of these three things in the first quarter of 2018.
18,
Now,
which I'll
for,
have done at the end of this year already, so
Yep.
will that count?
yes,
Okay.
because that's good for 6 months.
Okay.
So if you go to your personal care provider and have it done, let's say in December,
Mhm.
that's good for 6 months. So you would not need to do another one in the first quarter of next year. Same thing for these people that are catching up. If you've had yours done since July 1st of this year, that will be good for the first quarter of next year's results, so you won't have to go again.
But you have to do it quarterly,
No,
No.
it's an annual thing.
annual, the free, okay. Now I'm there.
And just a note on that too, like Jordan was saying, 6 months, if you're doing your annual physical with a physician, you can report those to Adam. There's just a simple form, I did it myself, I don't like getting my blood drawn more than once, so I use my physical as my biometrics, you certainly can do that. So like we said, super important, it's a benefit to you if you participate in this. It's fun to see if you are participating in the wellness, you're doing it, the changes in yourself from year to year when you get those new biometrics results.
The other thing, opposite works, as Kelly mentioned, if you get your blood drawn here at Wood County, you can give those to your primary care provider, and they can upload those results into your system, so you don't need to get it drawn again. You can print it right off of ManageWell and send them right to your physician.
Oh, so that's done for that, for your annual
Yeah.
stuff.
The other thing you can do, because I did this, is if your spouse has your insurance and they have the same program, you can send them these results, and they come for their wellness program also.
Alright, so I know that we already talked about Teladoc, but I just wanna remind you how beneficial this is to you. It's a money saver to you, it's a time saver to you, especially if you have children. A lot of people will use this for their children. You get a call, when you're at work, your child has a fever, needs to be picked up from daycare, you're 100% sure they have an ear infection because they have those frequently. Call Teladoc, tell them you can leave work, probably pick up the prescription and pick them up from daycare, all within a matter of probably the same amount of time you would have spent at the actual walk-in clinic or at your physician's office. And again, we did talk about Express Scripts, so I won't go too in-depth with that, but please, if you have any questions on it, talk to Human Resources, we can get you in contact with Express Scripts, call Express Scripts directly, find out if your medication is eligible for this. The one thing I want to point out, and we kind of touched on, you cannot get any more than a 30-day supply of your medication on our plan unless you do Express Scripts. So keep that in mind. If you are like me, I told everybody earlier this week, I got a text message from CVS that I haven't picked up my prescription in 2 weeks. I just forget. I don't go, and I run out of time, and they text me constantly. So if you're like me, this is a benefit to you. The information's on your card, the information is on the Human Resources intranet, just like Teledoc. And just a little side note, Tim Otteson actually came to Wood County and did a presentation specifically on Express Scripts and Teledoc, and it's available on the intranet. So if you want more information on this, came right from Tim. It's a great presentation to watch if you have a few extra minutes to spare.
Question,
Yes.
so has that changed from the 90-day okay for scripts? Because currently, you can get 90 days outside of Express Scripts.
You may have a certain exception, but typically our plan only allows a 30-day prescription. So there could be some sort of exception from your doctor. You might be squeaking by with that one right there, but typically they will only allow a 30-day prescription at a retail pharmacy. So again, this information is in your benefit guide, so please feel free to look in there for any of the contact information. The only thing that's not in your benefit guide is Diane and Tim's specific information, but this presentation today is going to be posted on the intranet, and we are going to post just the PowerPoint on the intranet. So you can always refer back to this if you don't remember what we talked about or want to look up Diane or Tim's information. So I will keep going for just a little bit. Kelly has joined us, but I'll have her jump in for the short-term disability because that's the one I'm a little bit more shaky on. So our vision plan with Superior Vision has not changed. This is the same plan that we've had before, but we do get frequent questions on our plan. So the first thing just to keep in mind is, again, like we talked with our health insurance, in-network versus out-of-network. You want to make sure you're going to an in-network provider to get the best deal for your money with this insurance. So you can see that your eye examinations are paid in full every 12 months. That's not a calendar year, that's a rolling year from when you last had an eye examination. Keep that in mind, that's important to remember. As far as your standard lenses, we do pay in full. Remember, that's after a $25 copay for materials. So you'll see it listed a few different times, but it's one $25 copay. So if you get frames and lenses, it's one $25 copay. You don't have to pay $25 each. But remember, when I'm saying standard lenses, it's the plastic lenses. I know a lot of times, I personally go to Shopko, and before I know it, I have like these super transformer glasses. I come out with all the coatings on my glasses. Those are extra. Those aren't covered under this plan. It's just the standard plastic lenses. And then remember, you can get frames every 24 months. Your lenses are every 12 months. Your frames are 24 months. And you do get the $150 frame allowance. And then you also can get contacts in lieu of eyeglasses. And that is paid in full up to $175 allowance. You can see it goes down to reimbursement of up to $150 if you go out of network. So you do get a better deal going in network. You can see for all of the benefits that you have under this plan. And then just so that you know, the contact lens fitting is included in your benefit because it's not part of your eye examination. If you've ever gone for contacts, you know that there's that extra $35 charge to get fitted for your contacts each time, so keep that in mind. And then just to touch briefly on the LASIK benefit that we do have in this plan, you will get in-network, that's the key word today, is in-network. You will get your 15% off your standard pricing or 5% off promotional pricing. And you can receive the $200 allowance in lieu of your eyeglasses or contacts. So you can't go in, in January and decide that you want contacts, and then in July decide you're going to use your $200 benefit for LASIK. It won't let you. You can only do one per year. And these costs have not changed. As Kelly would tell you, she was up here, Wood County does subsidize a significant cost of this premium for you. So if you do the math on what you would be paying, if even one person in your family wears contacts or eyeglasses, this is a great benefit to you. It's a money saver, and I'm all about money and time saving. And then this contact information is also in your benefit guide, and I don't know if I said it or not, but the benefit guide is on the intranet as well. Any forms that you would have picked up today are available to you on the Human Resources intranet. Our dental plan also hasn't changed, but there is some things that some people kind of get tripped up on as far as the Delta Dental PPO provider and a Premier provider. So you can see they're both kind of considered their in-network, but your PPO is going to be your best deal. So that's the person who you can get the best deal from on the plan. You can see your deductible will be $25. If you go to a Delta Dental Premier, it would be $50. So one of the most important things with this plan, if you do not enroll at higher, you are subject to waiting periods if you don't have other coverage already that matches this and are coming onto our plan. So if you don't have coverage through your spouse and you and your spouse just kind of decide you want to jump on our plan right now, you're going to have a 12-month waiting period for any basic services. That includes things like filling or emergency pain relief, and major services. So those would be like a root canal, crowns, anything like that. And then for orthodontic services, you would have a 24-month waiting period. So if you're coming on the plan because you realize your child is approaching that age where they're gonna need braces, so you're gonna break down and get insurance, you're actually gonna have to wait 2 years before you can get that for them. So it's important to enroll at higher with this, which all of us are past that already, or to enroll with something like a qualifying event, like your spouse is losing it, or you just decide that this plan is better, as long as it matches. So as long as the plan that you are leaving has orthodontic services, they will waive the 24-month. But if you're leaving a plan that doesn't have orthodontic services and you're coming on ours that does, you're still gonna have the 24-month waiting period. Anybody have any questions on that? Kelly does a much better job explaining that than I do.
No, you got it.
So if you sign up at higher,
Mhm.
the waiting periods are waived?
Yes, there are no waiting periods if you sign up right at higher with this plan, so it is a benefit to sign up at higher with this plan.
Now, what do you mean that higher?
As soon as you're hired with Wood
Oh,
County, when you're
at higher,
initially,
okay,
or if you were to go from like casual to benefited with Wood County, you would want to enroll right away.
At higher, that's
Oh,
what.
sorry, no, at your
higher.
start date,
Okay.
basically, when you initially roll in benefits with Wood County.
Is that a
Okay, so
change?
even if you're dropping your spouse's insurance and taking this one, because I'm full-time now, it'll be like new employee and
If you're
that doesn't matter.
if you're brand new to benefited, so as long as
Yeah,
you
okay.
move to 80% or higher, yes, it's your first eligibility.
Sounds good.
Is it-
I think it's just explained differently, because I know being hired 2 years ago, I wasn't aware that the waiting periods didn't apply.
At higher?
At higher.
Okay,
So I think that's key to communicate that upon hire.
Yeah, because I actually went to benefited in January
okay,
from casual.
yep,
I had a 6-month waiting period for my, I chose that, I chose the dental plan, but my dental insurance actually didn't start until August of
yep,
this year.
so that's not the waiting period we're talking about in
Oh.
here, that's just for our benefits, we have some that you're not eligible for until 180 days, and dental is one of them. All of our life insurances are like that, except for short-term disability, we're gonna talk about, but long-term disability is like that. And then our other benefits, our health and our vision and our flex spending have a different timeline when you're available. So upon initial hire, you do have a waiting period before your benefits start, but once your benefits start, you're not gonna be subject to the 12 and 24-month waiting period. Any other questions? All right, so just one little side note on the Delta Dental that not a lot of people are aware of. They do have their evidence-based integrated care plan. So if you have any of the medical conditions listed up here, or somebody in your family does, you or your dentist are able to contact Delta Dental and let them know, and they will be able to potentially get you extra cleanings, reduce x-rays, maybe even possibly implant benefits. Those are quite pricey, so keep in mind if you do have any of these, please do call and get those extra benefits for yourself or somebody on your plan. The costs for this have not changed, so if you're already on it, nothing's going to change. If you're entering, these are going to be the costs of the plan. And the contact information, again, is in your benefit guide. You can use the website, deltadentalwi.com, to find an in-network PPO or Premier dentist. As you could see from the slide before, the benefits for out-of-network are not good, and in some cases, they're zero. So make sure that you're using either a PPO or a Premier dentist. And then the last benefit that I'm going to talk to you about is our flexible spending benefits. So the IRS has not yet released what the maximum is going to be for 2018. So we are keeping it 2,600 for now. There's a possibility it could go up, it will not go down. So if you're one of those people that elects the maximum every time, don't worry, we will send out a communication to you so that you can change this if you need to. If you wanna hold off for like a week, the announcement should be coming very soon, usually by the end of October. So if you wanna just hold on to it, that's fine. Otherwise, we can always make a change with this one. If it comes later into November and December, we can always make a change with this too. This is one of those benefits that doesn't start until we're into January. So we have a little bit more leeway with this one. So just remember that this, the health flexible spending allows you to carry over up to $500 per year. So that's a nice little benefit with our flex spending account that some others don't have. And what you wanna do is kind of look at where you're at now, and if you are going to be carrying over 500, keep that in mind for what you're electing in the next year, because you don't wanna end up with way too much. So just keep that in mind. Also, our dependent care is not changing, so keep that in mind, and then you will, if you're not already enrolled, you will be issued a debit card that you can use if you do enroll in this. So it makes it nice and easy. You can just go to the pharmacy, or to the store, pick up what you need, use your debit card. Any questions?
Can you just put max on the health HFSA, just because it usually only goes up $50 a year?
Right, it could potentially go $2,650 is,
Could you just put max and fill it in, or do you have to list the whatever?
if you would like to put like the maximum amount, whatever, we will know, and if we question it, we'll
Okay.
contact you. So, if you wanna do that, that's totally fine too. So this contact information again is in your benefit guide if you ever have any questions on this benefit. I know we've had some people contact us that say their doctor told them to pick up something from the store, but their card said, no, you can't do that. It was just as simple as them calling Task, letting them know what was going on, and Task let them get those things. So their customer service is really great if you ever run into any issues. All right, and now I'll turn it over to Kelly to talk about our voluntary short-term disability plan.
Over the years, we've had a number of questions about short-term disability. Why doesn't the county have it, et cetera. And we went through and did an evaluation this year and decided to offer a voluntary short-term disability plan. This is basically an income protection for you. And we've had some people say, you know what, I got my sick bank or whatever, why would I ever need this? It gives you a lot of options with respect to your sick bank. You wouldn't necessarily have to exhaust your whole sick bank if you qualified for the short-term disability. So I'll talk about that a little bit in a minute. But this is basically a plan that's going to allow you to replace a portion of your income. The benefit is 66 2/3 of your weekly earnings up to $1,500 per week. We get a lot of questions on where did the 66 2/3 come from, how did we pick that? Ultimately, when you think about your normal take-home pay, you're going to be paying anywhere from probably 25 to 35% in taxes. So your actual take-home pay is less. We didn't want this to be set up so that you're actually receiving more of a benefit being on leave than what you were when you were working for the county. The other question that we get is, can I stack this? Can I get a benefit from this and also use my sick bank? You can't use both at the same time. But you'll see, how long must I be disabled before I will receive a benefit? It's 14 calendar days. What you can do is you can use your sick bank for those first 14 days, and then after that you would be able to begin to receive a benefit under the plan. So some of the people were thinking that that would be a better benefit to them. That way if they had something coming up, they wouldn't necessarily have to exhaust all those sick days. The pre-existing condition limitation. There is a 3-month definition of a pre-existing condition limitation. That means anything that is diagnosed, treated, for which you're taking medication, etc., in the 3 months prior to the effective date, so that'd be October, November, December, is going to be considered a pre-existing condition under the plan. What that means is for that specific condition, you would not have coverage until you've been on the plan and actively at work for 6 months. So if you're pregnant now and you're signing up, you're going to deliver before that 6-month period. It's clearly a pre-existing condition. If you were pregnant now, you're not going to have a benefit for that specific circumstance. But again, it's just a pre-existing condition exclusion on that particular benefit. if I get into a car accident, if I break my leg, if I need back surgery, and my pre-existing condition was pregnancy, all of those things are covered. So it's not that you have no benefits under the plan. You have no benefits for whatever that pre-existing condition is determined to be. I had somebody in the last meeting say, so if I wait until January to start trying to get pregnant, am I covered under the plan? You would be, because it wouldn't have been a pre-existing condition prior to the effective date. Does that make sense? The other thing is, that's a little bit different about this, is you're paying your contributions on an after-tax rather than a pre-tax basis. The reason for that is by paying the contributions out of your paycheck on an after-tax basis, your benefit is not taxable. That's what we were talking about before with the fact that you're only getting 66 2/3% of income. By paying that after tax, the benefit isn't taxable. If you did the contribution on a pre-tax basis, your whole benefit would be taxable, and that would be a significantly larger amount of money. Any questions on the short-term disability?
Is this available just for the employee or for?
It is just for the employee, because it's an income loss or an earnings loss, and it's specifically just designed for the county employees, so it would not cover spouses or children. We will have a personalized packet for you. We got some questions in the other meetings. Why am I getting a separate packet, and why don't I have it already? They're personalized based on your current income level and your age. So we wanted to make sure that each person got their own packets. So we've got them in different packets so that you can look at your information. Now, if you do get an increase next year, your pre-tax amount, a salary increase, your pre-tax amount may change slightly because it's a function of salary. There is a calculation in the benefit guide that most of you have that kind of shows you how to calculate it if you want to estimate. It's not going to be a significant change because it's just going to be a percentage of the salary that went up. We are asking that everybody turn in a form for short-term disability, even if you're waiving coverage. And again, it's the form in the yellow packet. I think there is a place on the regular form that talks about short-term disability. Because it's a different carrier, if you are enrolling in short-term or waiving, etc., we need the forms back that are the Mutual of Omaha forms. The premium costs, again, we talked about those being based on salary. The rates are guaranteed for 2 years. So again, if you have a salary increase, your rates are going to go up. But for 2018 and 2019, there's going to be no rate increase because the rates are guaranteed. And I think I talked about the rest of this stuff. The contact information, again, is in your benefit guide. At the beginning of the benefit guide, there's kind of 800 numbers, policy numbers, things like that, contact information. So that information will be in there, as well as the 800 number if you have specific questions once you're enrolled or questions about the policy in general. The benefit election forms are due by November 3rd. That's all the forms, so your normal enrollment form as well as your flex information and the short-term disability information. The new premium rates for those items that are pre-tax are going to begin on December 9th. This is the time to update your beneficiary contact and your emergency contact information. We've had situations where somebody got a divorce 3 years ago, never thought about the fact that they really hadn't changed their beneficiary, and then if something happens to them, it's going to get paid to the ex-spouse. Or you've had additional children and you want to add children to the plan, etc. So it is important that you look at that once a year and just make sure it's accurate. Also, with respect to the emergency information, the same thing. You don't want something to happen to you and they're trying to contact someone and they find out the phone numbers that they got are incorrect. In the benefit guide, we do have information. Kate is one of my coworkers. She is in the office a little bit more than I am, so it's a little bit easier to get in touch with her. If you run into claim issues, generally we would want you to call the carrier first, but if you call, let's say you call WPS and you get an answer and it just doesn't make sense to you, or something doesn't seem right and you just want additional clarification, Horton can help with any of the related benefits. So whether it's medical, dental, vision, short-term, flex, any of those types of things. I am the only Kelly in the benefits area, so if you call Kate and she's not able to help you with something, she can transfer you to me, or if you call her number, you can just ask for me. I also have business cards. If somebody has something specific they want to talk to me about, I can provide those as well. We have Jody's name listed here. I'm thinking that Kelly probably mentioned this earlier, but Jody is kind of in and out right now. So if you have any specific questions for HR, you're going to either want to go to Kelly and Jody both if you were sending an email as an example, or probably go to Kelly at this point just because she's in the office a little bit more if you happen to have questions. Are there any other things that we didn't cover? Any questions you thought about as the presentation went through? Anything that doesn't make sense or that we can help with?
If our spouse or dependent has not changed, can we leave that blank?
Kelly, do you need the beneficiary stuff back even if it's not changing?
We do want it back because we want to double check that we have the right information.
So if we had like supplemental life insurance and stuff, we need to, what if we just want to carry what we had?
If you are interested to know what you had, you don't remember, you can meet with me afterwards. I do have a binder that has it. We still want you to fill it in because we want to make sure everybody knows for sure what they have. That's why we don't do the checkbox anymore, where you can just say keep it the same. We want to make sure that everybody knows because we're running into a lot of situations where people had no idea what they were enrolled in anymore and they just kept checking enroll me. So if you have any questions on what you're currently enrolled in, I can help you with that afterwards.
Okay.
And medical option 2 WPS statewide includes like Marshfield Clinic.
Yes, that is the broad network that we talked about.
Okay, well, everybody pick up your, we've got your forms in alphabetical order. I think between Kelly and I, we probably pulled most of them, so we'll get you your forms and get you out of here. Thanks, everybody.
Oh yeah, the red button right there.
It would be this one.
I forgot that one.